702.
The Big Interview
With Bongani Bingwa.
17 after 7. Now, picture this. A hospital is preparing for an inspection. Everything looks perfect. The autoclaves, the ECG machines, the patient monitors, the ventilators, all the necessary equipment is in place and in tip-top shape. And at every other hospital the inspectors visit, they see the same. Quite literally. Because the facilities are sharing some of the same equipment, borrowing from each other to try and pull the wool over the inspector's eyes. The country's health standards watchdog, the Office of Health Standards Compliance, is warning that this window dressing is becoming a common practice. And it raises questions, of course, about patient safety, but also the readiness of hospitals ahead of the national health insurance rollout. We've invited both guests today to explore both sides of the story. We've got Dr. Nicholas Crisp, the Deputy Director General of the National Health Insurance Division in the Department of Health, and Dr. Siphiwe Mndaweni, who is the Health Standards Compliance CEO. And I'll start with you, Dr. Mndaweni. A very good morning to you, and thank you for your time.
Good morning, Bongani, and good morning to all the listeners and to Dr. Chris.
All right, talk to me. Firstly, what is this window dressing? Did my introduction describe it accurately?
In part, Bongani, let me just explain what exactly it is. It's an observed a practice during our inspections where I'll call it a deceptive practice where equipment would be borrowed from one side of the clinic or facility to another side. Now, this creates a sense of false impression that a particular standard is adhered to. It's really borrowing equipment and moving things around. Now, in your opening statement, you said it's common practice. Let me clarify that at the moment, we would not define it as systematic or as widespread, but we have observed sporadic incidences where there are facilities that would actually borrow things amongst each other or even within the facility itself. And these instances are spotted by inspectors themselves as they conduct the inspections. But they are significant enough for us to raise concerns around them.
What's the most common type of equipment that is exchanged in this way?
Okay. In the main, it would be the emergency trolley. Each and every clinical area where services are provided, there must be an emergency trolley for, resuscitation and whatever would be required, to save a life. Now, what you would find is that this trolley would be moved from one clinical service area to another. The other common one would be the portable what we call ambu bags. These are medical devices that are required, during resuscitation, as well as the defibrillators. These are also medical devices that are required when you are resuscitating a patient. In the main, those would be the equipments that are usually moved within facilities.
There was something about documents, if I understood that correctly. Where does that come in?
So the documents, there is a protocol that must be followed in terms of the policies, the protocols, and the SOPs. Now, to force compliance, at times, you would find that the signatories or the people that have actually attached their names there are not the people that are accountable. Now, it would mean that that document was not signed, so we don't know the authenticity, or those documents will be received from the district maybe in the morning. So again, that's when facilities are trying to fabricate or force compliance with a particular standard. We're very strict in terms of looking at the accountability levels, because whatever documentation that is used in facilities, to manage patients, we want to ascertain that it has gone through the appropriate level of approval.
How much do you prepare institutions or facilities ahead of your inspections? Do they know you're coming?
In the main, they do know that we are coming. We do give them a notice of announcement that we'll be conducting inspections. And this we do mainly so that we can be able to find the appropriate personnel and they can be aware that we are coming, and also be in a position to arrange the services because they are at work. But in terms of us having realized that we have this challenge, we are going to start conducting more unannounced inspections where we will not necessarily inform the facility that we are coming. They will just see us showing up, so that in part we deal with this issue of window dressing. But once again, it would be also targeted on those institutions that fail or that are perpetually not adhering to standards. It's not going to be in all of the institutions. As I've indicated, that we have noticed that it is just sporadic occurrences, but we are concerned that we need to make people aware that it is a phenomenon that is happening. Yeah.
I mean, I would imagine that, spot visits should be the order of the day. I mean, that's obviously the difference between an open book and a closed book kind of examination. If they know you're coming, they'll prepare for you.
Well, they would prepare in terms of being available, because we do want them. Remember, when we undertake an inspection, we use various methodologies, observation, interviews, as well as document review. So we need all of that. But I must say, Bongani, it doesn't mean that all facilities are doing this. We've got a high number of facilities that are doing their utmost best to adhere to the standards. It's just those, outliers which we need to deal with.
All right, but I mean, there are enough of them for you to raise the alarm about this. Are there any consequences for this kind of thing?
Absolutely. We, as a regulator, we are allowed to take enforcement action. Now, in instances where this is spotted, immediately we disqualify them. They don't. They will be non-compliant with that standard. We issue them with written warnings and also what we call a compliance notice. A compliance notice will give you a very definite timeline to adhere to that standard, and we will ascertain that we come back to verify, as well as also refer for disciplinary action where we feel that this is serious enough.
All right. What about criticism of your own issues there, Dr. Mdaweni? Understand that even though you've spent more than 100% of your budget, you weren't able to inspect all the facilities that were part of your target list.
That is correct. The size of our mandate, if you consider that in the country we have in excess of 50,000 facilities, which we must reach at least once in 4 years. With our current capacity, the reality is that we are unable to do so. And it is a valid criticism. We are all operating in a very, a budget-constrained environment. We are looking at other various methods of how we can actually expand our inspection footage in the country. And there are various things that we're looking into, but definitely at the moment, we're not adequately.
Last question, and one that Dr. Crisp, no doubt, will be very interested to hear the answer to. Are we, in your view, ready for NHI?
Yes, in my view, and in our view as the regulator, the state of readiness in the healthcare sector can never be uniform. But we have all that it takes for our facilities to be able to participate in the NHI. The fact that we are conducting these quality assurance inspections in facilities, we are raising these issues for awareness, we are assisting facilities to comply with the norms and standards. We believe that we have all the apparatus that we require for the NHI, and also working very closely with Dr. Chris' directorate as well. All
right, Dr. Mdaweni, I appreciate your time listening to all of that, and I'll really thank you for your patience, Dr. Nicholas Crisp, but I thought it's important that you hear that full context of what Dr. Mdaweni had to say. So thank you for your time. She says it's not as widespread as perhaps people might have been concerned it is, but nonetheless, are you dismayed by what she's raising the alarm about?
Morning, Bongani and the listeners, and morning to Dr. Mdaweni. So we've answered parliamentary questions about these allegations before, so it's not something new to the department. There have been allegations raised by members of the Portfolio Committee in Parliament about allegations in clinics where similar statements have been raised, and they've been investigated every time and followed up. As you heard Dr. Mdaweni say, we work very closely with the regulator, and we are concerned about how to build a proper quality management. And, inspection is not about inspection. It is also about making sure that standards are improving all the time. And so that's what we are actually working towards. And we do find some excellent facilities and others that are really shocking. And the real challenge for us is to work with the departments, because I'm sure you're aware there are many health departments in the country. We need to work with them to make sure that they understand where these gaps are and what they're going to do about fixing them.
But this kind of thing obviously does pose a risk rather to patient care.
Yeah, sure. Yeah, we see it in the private sector. We see it in the public sector. We see it everywhere. There are people who take chances. Unfortunately, we live in a society where you have to be incredibly vigilant. And it's extremely irritating for the many people who work so hard to do things right when somebody does something like this and spoils it for the majority who are trying to do the right thing.
What consequence do they face?
Well, as you heard, from a regulator perspective, there are things that they can do about it, and of course they report it to the health department concerned. So, it'll be usually one of the provincial health departments, because they are the largest that get inspected, and then the action is for the management of the provincial health departments to take. And then, of course, the inspectors go back and they check. So they will reschedule to make sure that whatever was non-compliant has to be met with.
All right, Dr. Nicholas Crisp, appreciate your time. Deputy Director General of the National Health Insurance Division at the Department of Health.
Current events, developing stories,
Tough questions.
your voice making a difference.
This is Breakfast with Bongani Bingwa.